Great to see you again. Today we are going to continue our discussion on dealing with depression and anxiety. We are going to concentrate specifically on anxiety in this session and look at how it affects people and reflect on how it might be currently affecting you. Importantly, we are going to explore some different techniques over the journey, which you can use in your daily life and help to get you back on track. We are in this together and I'm here with you every step of the way. Would you like to begin today's session? Everyone feels anxious now and again. It's a normal emotion. Many people feel nervous when faced with a problem at work, before taking a test, or making an important decision. Anxiety disorders are different though. They can cause such distress that it interferes with your ability to lead a normal life. This type of disorder is a serious mental illness. For people who have one, worry and fear are constant and overwhelming, and can be disabling. But with treatment, many people can manage those feelings and get back to a fulfilling life. Let's do a little anxiety test. Over the last 30 days, please rate your anxiety score on a scale from 1 through to 10. Please score as if 1 is that you haven't experienced any anxiety and 10 is that you have experienced uncomfortable anxiety on a regular basis. Since you scored yourself above 5, this indicates that you have experienced a higher than average level of uncomfortable anxiety recently. The good news is this session will hopefully give you some tips on how you can help curtail these uncomfortable feelings. Let's continue. If you suffer from panic attacks, obsessive thoughts, unrelenting worries, or an incapacitating phobia, you may have an anxiety disorder. But you don't have to live with anxiety and fear. Treatment can help, and for many anxiety problems, therapy is a good place to start. Have you ever taken part in a therapy session before? Certain types of therapy, such as cognitive behavioral therapy, are particularly beneficial. This therapy can teach you how to control your anxiety levels, stop worrisome thoughts, and conquer your fears. When it comes to treating anxiety disorders, research shows that therapy is usually the most effective option. That's because anxiety therapy, unlike anxiety medication, treats more than just the symptoms of the problem. Therapy can help you uncover the underlying causes of your worries and fears, learn how to relax, look at situations in new, less frightening ways, and develop better coping and problem-solving skills. Therapy gives you the tools to overcome anxiety and teaches you how to use them. The anxiety disorders differ considerably, so therapy should be tailored to your specific symptoms and concerns. If you have obsessive-compulsive disorder, your treatment will be different from someone who's getting help for anxiety attacks. The length of therapy will also depend on the type and severity of your anxiety disorder. However, many anxiety therapies are relatively short-term. Now a quick quiz question for you. What is the name of the therapy that has been shown to be very effective for treating anxiety? That's correct. Fantastic work for paying attention. If I could fit my little hand through this glass screen, I would definitely give you a high five. Enough wishful thinking though. Let's take a closer look at cognitive behavior therapy. Cognitive behavioral therapy, or CBT, is the most widely used therapy for anxiety disorders. Research has shown it to be effective in the treatment of panic disorder, phobias, social anxiety disorder, and generalized anxiety disorder, among many other conditions. Cognitive behavioral therapy addresses negative patterns and distortions in the way we look at the world and ourselves. As the name suggests, this involves two main components. Cognitive therapy examines how negative thoughts, or cognitions, contribute to anxiety. Behavior therapy examines how you behave and react in situations that trigger anxiety. The basic premise of cognitive behavioral therapy is that our thoughts, not external events, affect the way we feel. In other words, it's not the situation you're in that determines how you feel, but your perception of the situation. Let's take a look at this with an example.